Traditionally, there's always been a sort of misalignment between the management and the doctors in most of the corporate setups. And I think that's been one of the key reasons why many of us, like who had been working in corporate hospitals, had to leave the corporate setups. So how do you think this is going to be made better with people like yourself coming into the picture? How do you think we're going to improve this to create a better working environment and to create better enterprises? What's your take on that? How this relationship can be improved?
So I think professionalizing the entire healthcare environment is a very important priority for all of us. If you look back and if you see what has really happened in this sector for a long period of time, quote unquote, families have been running healthcare enterprises. And the managements that they have do not have the depth of experience that is required to run these enterprises in a very professional manner. So effectively, that conflict that constantly used to happen and continues to happen is because the interests of the clinicians and the interests of the enterprises do not get aligned so well. And that is the reason why that conflict starts, because you want to add new technology, you want to add more people, you want to add more services, and suddenly the prioritization of that particular hospital is a lot more around certain other specialties. And you feel completely conflicted that this management just does not understand the need of my specialty. And I've seen it happen a lot in my past, and I know that why that friction happens. And that is also the reason in some way, Dr. Arun, that we are seeing this entire push towards single specialty care. Because many of the specialists who are sitting in the large format multi-specialty institutions are today rethinking which end of the curve does their specialty lie inside that large multi-specialty institution. And if it is not really a big priority for that management, then they see that going outside and creating something of their own is probably a much better opportunity and much more focused, much more advanced, and create clinical distinction around them. So I think this conflict zone that exists between management and clinicians, first of all, I think experience also helps a lot. Because I also know that there are a lot of other private equity funds today which don't really have the understanding of clinical depth. They don't have the understanding of what it takes to interact with clinicians. But then there are others like us who have really spent all our lives in the operating rooms with our clinicians, and we understand their needs better, and we understand what they require much better. So I'm hoping that as these transitions happen, and as we get into more organized play, the way that we are currently focused on, we will see a lot of the management and the clinician ecosystems coming together to create great collective success.